mynews.studio.
Picture this. Not long ago, 1.5 billion people faced the threat of a disease. And now, that number is on the verge of disappearing. How did we get to this turning point?
We're recording on February 8th, 2026. Let's focus on trachoma. It used to be the top infectious cause of blindness, but now the number of people at risk has fallen by 94% since 2002. That's just under 100 million people who still need treatment. How did change happen so fast?
It really comes down to global teamwork. Governments, NGOs, and communities all pulled together using what's called the SAFE strategy. That's surgery, antibiotics, facial cleanliness, and environmental improvements. But the real question is, why did SAFE work so well?
It wasn't a cookie-cutter approach. The SAFE strategy was tailored to local needs. For instance, some health workers used local languages and traditions to teach hygiene. In other places, they relied on smartphone surveys, like those from the Global Trachoma Mapping Project, to pinpoint at-risk areas, even in really remote spots. That kind of precision, using data to guide where help goes, makes a big difference.
And the results are clear. 27 countries have now been validated by the WHO for eliminating trachoma as a public health problem. Think about the range: Benin, China, Fiji. Still, progress doesn't mean the job's finished. Why not?
Because the last stretch is tough. There's still a $300 million funding gap for things like surgeries, medicine, surveys, and ongoing research. Ethiopia, for example, has the highest number of cases left. Its vast rural areas and limited sanitation make progress harder. So, is it realistic to hope for elimination by 2030?
It's within reach, but only if investments pick up and local leaders are supported. There's another angle too: gender. Did you know women and girls are more likely to get trachoma because of their roles at home?
So the solutions had to address that. Mass drug administration wasn't just for individuals, but for whole households. Plus, training women as surgeons to treat trichiasis built trust and made it more likely women would seek care. Gender equity here wasn't just the right thing. It actually made the programs work better.
Stepping back, even beyond eyesight, preventing blindness lets people work, go to school, and be active in their communities. That leads to better living standards for millions. Isn't that the real goal of public health?
It's a strong example of what global health can do: steady funding, working across borders, and engaging communities. Lessons that go beyond trachoma, really. They matter for any preventable disease and for whatever comes next.
So, to sum up, risk from trachoma has dropped by 94%. The SAFE strategy has been at the core, and while there's still work in places like Ethiopia and in bridging funding gaps, we're closer than ever to eliminating this disease.
This story shows that with global action and local adaptation, even complicated health problems can be solved. Thanks for joining us as we followed the path toward eliminating trachoma.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.